Study Session 4: The Social and Cultural Psychoanalysis of Karen Horney. Introduction. The aim of this study session is to introduce you to another neo-analytic perspective in personality theories. We shall learn about Karen Horney's concept of human personality structure and how this guides the way we behave. When you have studied this session, you should be able to 1. Explain the concept of hyper-competitiveness in human behavior. 2. Discuss how to cope with different feelings of basic anxiety. 3. Identify 3 basic anxiety trends. And 4. Discuss the assessment technique of social and cultural psychoanalysis. Horney's perspective on neurosis. The focus of Karen Horney in social and cultural psychoanalysis was neurosis, and she concluded that hyper-competitiveness is the bedrock of the development of neurosis. Horney, 1937, observed that the society is highly characterized with hyper-competitiveness. This she described as an indiscriminate need to compete and win, and to avoid losing at any cost as a means of maintaining or enhancing one's feelings of self-worth. Hyper-competitiveness also includes feelings and thoughts of manipulations, aggressiveness, exploitation, and derogation of others across a myriad of situations. In the attempt to trace the root cause of this phenomenon, Horney stated that hyper-competitive individuals are from families where they are verbally and physically abused by their parents. They internalize the abuse and unconsciously develop feelings of powerlessness and insignificance. This will usually lead to attempts to attain unlimited success and power to overcome their feelings of inadequacy and inferiority. These individuals become preoccupied with a sense of self-importance and exhibitionism, designed to win attention, recognition, and admiration, according to Rickman, 1997. Their only weapon is indiscriminate competition, and they can be ruthless in it. In a study to ascertain the validity of Horney's claim, Rickman, Hammer, Kaczor, and Gould, 1990, constructed a scale that measured hyper-competitiveness, and they found empirical support for Horney's idea. Results from this study show that college men and women who scored higher in hyper-competitiveness were generally less psychologically healthy than were college men and women lower in hyper-competitiveness. The result also indicated that individuals higher in hyper-competitiveness had lower self-esteem and higher in narcissism, exhibitionism, neuroticism, mistrust, and dogmatism. Etiology of neurosis. Horney stated that neurotic tendencies develop from the family. According to her, parents adopt the values of the society, and this makes them to be in direct competition with the children, thereby leading to neurosis. Attitudes of parents' direct or indirect domination, indifference, lack of respect for the rights of children, disparaging attitudes, lack of proper guidance, discrimination, etc., can cause disturbed relationship that will lead to neurosis. Horney, 1945. However, it should be noted that only one of these factors may be enough to cause neurosis, but not necessarily a combination of factors. These negative factors create what is called basic anxiety, and when this is sustained over a period of time, neurosis results. Using neurotic strategies to cope with basic anxiety. In a bid to reduce or cope with basic anxiety, individuals tend to embrace certain defensive attitudes, which serve as temporary relief and buffer from their anxiety. These defenses on the surface may look ordinary and normal, but become abnormal by their compulsiveness, rigidity, and discriminate usage. Horney identified 10 neurotic needs. These are: 1. The neurotic need for affection and approval. 2. The neurotic need for a partner who will take over one's life. 3. The neurotic need to restrict one's life within narrow borders. 4. The neurotic need for power. 5. Neurotic need to exploit others. 6. Neurotic need for social recognition and prestige. 7. Neurotic need for personal admiration. 8. Neurotic need for personal achievement. 9. Neurotic need for self-sufficiency and independence. And 10. Neurotic need for perfection and unassailability. 3 basic neurotic trends. While trying to expound upon the neurotic coping strategies, Horney found that there were commonalities and similarities among the 10 strategies earlier identified. This helped her to classify the 10 into 3 basic types. 1. Compliant types. Individuals in this category manifest the need to move toward people. They compulsively seek approval, partner to control their lives, and a life contained within restricted borders. At the end, they tend to be self-effacing, submissive, and they devalue their own talents and abilities. 2. Aggressive types. These usually have neurotic needs for power, exploitation, social recognition, and prestige. They are always moving against people because of their belief that other people are hostile and untrustworthy. They believe more in survival of the fittest. 3. Detached types. These types are characterized by indiscriminate need for self-sufficiency and perfection. Their behavioral manifestation is that of moving away from other people. Assessment techniques. Horney, like Freud, used the free association and dream analysis in treating patients. She felt these will help therapists identify the sources of the neurotic problems. Meanwhile, she did not agree with the classical psychoanalytic position that dreams and content of free association should be interpreted, especially in light of thwarted sexual conflict. Rather, Horney's interpretations focus on patients' actual experiences and coping strategies adopted for basic anxiety. Furthermore, Horney disagreed with Freud that therapists must refrain from making value judgments about patient personal experiences. She advocated that therapists should be more honest and open with patients and more active in offering suggestions in order to facilitate the growth of the relationship and lead more readily to a cure, according to Rickman, 1977. Study session summary. In this study session, we have discussed Karen Horney's theory of social and cultural psychoanalysis. The central claim of the theory is the human personality is modified by past and present social-cultural experiences, and this places a strong probability of making someone to be neurotic towards achieving certain objectives in life. She distinguished 3 types of basic neurotic trends in human beings, namely compliant, aggressive, and detached trends. End of study session 4. Thank you for listening.